We are women. We come before you exposed to speak of things you do not understand, to plead with you to understand the truth. We come before you to raise the issue of abortion.
We killed that woman and did abortions the next morning.
And many times you'll see a young lady who's been killed by abortion, and on the death certificate you see something like spontaneous gangrene of the ovary or therapeutic misadventure.
To talk about something that uses lies, coercion.
But we all have that moment where we realize that we are moms and we killed our children. It's pretty sick. It's a sick feeling.
Too many people who are angered by the issue of abortion, whether they be pro-life or pro-choice, are completely ignorant of the beast of which they speak. Too many women cry for rights to something which they are too naive to research for themselves. Too many people judge unfairly the women who have been deceived into making this choice. We are all victims of this web of genocide. We are all made the fool. So if you value truth at all, please listen. Abortion is not, as most claim, a simple procedure, a quick fix which will simply remove tissue which will solve all of your problems. It is a potential death trap which can cause pain, psychological torment, or more often than you may believe, death.
There's a lot of evidence of physical and psychological consequences. Then there was a big study out of New Zealand about 2 years ago that showed long-term consequences.
Abortion can have long-term consequences on the woman in terms of affecting her fertility.
Many women become infertile. They suffer from other problems with their female organs and end up having to have complete hysterectomies, never able to conceive or have other children.
Depending on the type of abortion performed, physical complications can include cervical tearing and laceration from instruments, the perforation of the uterus, which may require major surgery, including a hysterectomy.
He literally perforated her uterus and was pulling her bowel out her uterus with the very first time he went in with the instruments. And the second time he went in, he pulled out her bowel and he pushed it back in. Live baby. Woke the woman up, put her in my car because it's terrible advertisement to think about having an ambulance in front of an abortion clinic. You just don't want it. So we put her in my car, and we didn't take her to the hospital nearest us. We didn't take her to the hospital that would take the best care of her. We took her across town to a hospital that would help us cover up what we'd done. And this surgeon has taken this girl who has a perfectly complete baby inside her with her bowel pulled out her vagina upstairs to the operating room. 7 doctors operated on that baby, on that girl. They had to do a colostomy to resection her bowel to empty into this bag. They pulled the baby out. He rolled it into the disposable drapes and put it into the incinerator at the hospital. All 7 of those doctors falsified the records. We killed that baby that way. The doctors falsified the records. We told that girl she had an abdominal pregnancy, and she didn't sue us.
Retained tissue indicated by cramping, heavy bleeding, and infection, which is when pieces of the fetus is left behind to rot inside the womb. Post-abortal syndrome, referring to an enlarged, tender, and soft uterus retaining blood clots. Failure to recognize an ectopic pregnancy, which could lead to rupture of the fallopian tube, hemorrhage, and resulting in infertility or death.
Our complication rate at the end of my time, last 18 months, was when about 1 out of every 500 had a major life-changing surgery or died. We had 1 woman die. But because there are no real statistics, and if you can cover it up, you don't report it, and none of ours were ever reported. So we don't really know. The big hospital in Dallas will tell you, the doctors will tell you that they saw botched abortions or see botched abortions all the time. One of the reasons we were able to regulate the abortion clinics in Texas was because of the bad abortionists that had been reported. I mean, one girl died and they went in to examine the clinic and they were using rusted instruments and had no sterilizer and no hot water. But no one talks about what happens inside the abortion clinic. And everyone fights. It's the most chaotic place you can imagine. They didn't care if the instruments weren't clean and they didn't care if the instruments weren't cool. They just wanted to get their money and get through the day and go.
The right to choose is the most commonly thrown out phrase when speaking about abortion. It's the woman's right to choose. How is a woman supposed to choose anything when she's been lied to by society? Women are not told the dangers of abortion, the size of their child, the emotional risks involved.
I felt them taking parts out of my body. You know, I've spent the better part of 20 years trying not to remember that, but I do.
We had a 12-year-old. She came in chewing her gum and looked so carefree. She had her abortion. She came back 2 weeks later for her checkup. Didn't come out of the room, opened the door, and she was in there. She'd brought in a piece of glass and slitting her wrist. 12 years old.
How the procedure is done, and more often than not, they are not even allowed to look at the sonogram in case she may change her mind.
If it's positive, we trained our people to reach over and grab the bony part of her elbow and squeeze. And you see, she's confused. She's hurting. She's just gotten this news that she's pregnant, and she's upset. So you grab the bony part of her elbow and squeeze to get her attention and say, if you have your money, we can take care of this right now. We knew if she went home and talked about it, her support system might help her and might tell her abortion wasn't the answer, but if she just did it right then, it was taken care of.
How can a woman choose when she's told she has no choice?
The number one slogan for abortion is pro-choice. And the ironic thing about that slogan is that when you ask women who had abortions, why did you have that abortion? The number one response is, I felt that I had no choice. A majority, maybe upwards of 80% of abortions in America happen with some form of coercion. In other words, not the woman's choice.
Lastly, we'd like to bring up the most inconvenient truth of all involved in abortion. Is the child alive? There are those who will insist up and down that a fetus is nothing but a mass of unformed tissue. There are those who will shove pictures of an aborted child in your face, tell you how far along the fetus was formed, how there was a heartbeat, how there were brain tissue. People are angered by such images. People are angered by such claims. They shut it out and proclaim that they are hateful and ignorant. We'd like to use a different approach. We'd like to show you something you cannot deny, something you cannot shut out without being completely in denial. We are going to show you the silent scream, a mass of lifeless tissues and unformed and non-living things as they are ripped from the womb.
You will note that as the suction tip, which is now over here, moves toward the child will rear away from it and undergo much more violent, much more agitated movements. The child is now moving in a much more purposeful manner. Its orientation changes from time to time. It is rearing again here. Now the suction tip has not actually touched the child, even though the child is extremely agitated and moving in a violent manner. The child has now moved back to the profile view, and the suction tip is flashing once again across the screen. The child's mouth is now open, and we will see that again on a freeze frame in a moment. But this suction tip, which you can see moving violently back and forth on the bottom of the screen, is the lethal instrument which will ultimately tear apart and destroy the child. It is only after the fluid has been broken, the sac has been disrupted, that the tip will actually come against the child. But we can see the tip moving back and forth as the abortionist seeks the child's body. Once again, we see the child's mouth wide open in a silent scream in this particular freeze frame.
We tell you this not to change your mind, because there are those minds that cannot be changed. They are too deeply indoctrinated by society, by the media, by their own need for convenience. We tell you this to educate, so that you may know the truth, whether you are willing to admit it or not. We come to you about the issue of abortion.
I recognized I'd been involved in the death of 35,000 babies. The murder of one woman who bled to death from a second trimester abortion. 19 women who'd had hysterectomies or colostomies. And never had one appeared in the newspapers, no lawsuit. But the thing I couldn't deal with was the fact that I had taken the life of my own child by abortion.